to thank you. Thank you for giving us the opportunity to be here. Thank you for giving us the opportunity to help our fellow man and help the hospital help our fellow man. We're always open to your help, and we need it daily. So we thank you in your Son Jesus Christ's name. Amen.
Amen.
Okay, we'll get ready, call the meeting to order. The minutes of the meeting dated February 17th, 2026. Need a motion to waive the reading of the minutes and approve the minutes of that meeting. Eric?
Second.
For Tim. All those in favor, aye?
I will abstain. I wasn't here.
Wasn't here, okay.
I wasn't able to watch it, so.
Okay, so you got that, Wendy? Yes, okay.
I know.
Consent items. Consent item for contract for revenue cycle services. Need a motion to approve the contracting with Healthcare Chaos Management for our revenue cycle as recommended. Do I have that motion? Jimmy, second. Nancy? All those in favor? Aye. Any nays? Don't worry, Harry, I'll get you.
Wasn't gonna let me go.
Consent item again, impact printer lease renewal. We need a motion to approve the impact printer as recommended. I have a motion to
Motion.
Impact printer. Cheryl?
I'll
Motion.
second.
Ed, second. Thank you. We have several consent items here, like, let's take the first one, go down through here, infection control. That was in your packets last month. We need a motion to approve infection control plan.
I'll do that.
Okay.
I'll second.
Jimmy makes the motion, Cheryl seconds, all those in favor, aye. Any nays? Okay. Post-exposure evaluation for bloodborne pathogens. Need that motion, Harry? Tim second, all those in favor, aye? Passes. Consent item, quality assurance performance improvement patient safety plan. We need a motion to approve that plan. Have that motion, Nancy?
So
Second,
moved.
Harry, all those in favor?
Aye.
Any nays? Okay. There's no consent items that will be up this next time for April. If you have something comes up, Brenda, can you put it on at that time, okay?
Yep, sure.
All right.
There were just no plans or anything for approval in April, which is what I have a heads up on.
Okay, thank you, Wendy.
Yeah, we do have some upcoming capital purchases that are listed there.
Yeah, that's scheduled upcoming capital purchases, and that would be for board approval due to cost being greater than $50,000, and that lists in March, April, July, August, October, the things that we've got going on at that time.
So like March of this year?
Excuse me?
March
Yeah.
of this, like now?
Right.
Okay.
Right.
I just didn't get the cargo van on this month, it'll be on next month.
Yeah.
Okay, gotcha, okay.
Okay, let's go to review write-offs. Rebecca?
So this month you'll see on the hospital, it's kind of the catch up from last month, which we did not get done in January. But if you look at the 2 months combined, you can get the average, and the average is across the board, it's less than what our average was for the whole year. So the first 2 months, we seem to be doing a little better. I think we're getting to the point where I think HEM is gonna make a difference, what you approved with them on
Okay.
write-off stuff. I think getting a company in to review things and look at things ahead of time before it ever gets to this point.
Okay.
The other two, my clinic and specialty, those are always smaller. Very, very much, you know, I mean, it's a lot less, and it's because, I think it's probably because the system's different, right? So the clinics, all the clinics run through Athena. So, and it's just a lot less, like volume-wise, it's a lot less running through there. So less dollars, less volume. That's why those two are always gonna be smaller.
Anything else? Okay. We need to have a motion to approve the write-offs as recommended. Dr. Powers, motion. Harry, second. All those in favor, aye.
Aye.
Any nays? Let's go to administration report. Brenda?
Yep, so I have a comment from a patient, this is a med-surg patient. My grandpa is staying in med-surg and is pretty rough shape. Holly and Brinley were assigned in the room and they were fantastic. They were polite and respectful and also very personable. They made sure there were snacks in the room and patient with questions. As my family navigates the season of our lives, those two ladies have made the experience much easier. Thanks for all you do for making this hospital a better place. And this next one is actually from an ER physician. So this is a physician perspective. But this is a new physician working for us. Said, I think it is so amazing how well the night shift staff I have worked with thus far have come together as a team to get things done and get patients taken care of. As I was driving back today, one of my friends who is a fellow night shift doc called. I was telling him about the volume and the acuity of patients that we saw the last 3 nights. At the end of the call, he asked me how we did that in an 8-bed ER. And that's when it dawned on me just how truly amazing it really was. It was truly a pleasure working at GCGH last weekend, and I'm looking forward to being back on Friday. Also, thank you for your hospitality and help as I learned the ropes of the hospital and community. So, just a really nice compliment of our team there. For opportunities, we have gotten feedback from our families that the boards, the whiteboards that we have in the patient rooms on 3rd floor, are not always helpful and don't really give them information that they want. So we're working with our caring council to update those boards and make sure that we have pertinent, relevant information for them on those boards. And also, as you just approved HCM tonight, I will say one of the frequent complaints we get from patients is the calls that people get whenever they're trying to collect on payments. That oftentimes they're confused. It's not someone they would expect to get a call from. The process for just making payments is kind of difficult. And with HCM, there will be new bills that will be going out to patients that will hopefully be easier to understand. There will be some payment processes with that. The phone calls will be different. They can get text messages. So I think that's going to improve our patient experience around bill pay as well.
You know, when it comes to bills getting in the mail, because I know this happens to me, does any hospital actually give an itemized, do you have to ask for an itemized bill? Instead of it just says, you know, a broad section gives the, you know, how much was billed and how much they paid and how much they took off, but.
So part of the problem with that though is the billing practices that the payers want to see. So like, you know, we previously talked about Anthem and some of their billing practices, whereas Anthem in a surgery, they don't want to receive an itemized bill. They want a bundled charge that does not have itemized on it. So some of it is just the way the payers want it. It
Right.
doesn't get reflected that way.
Okay,
Patients can always call and ask them,
okay,
and we'll help them understand, but sometimes things are lumped into one charge code instead of being
Right.
everything that falls into that.
okay. Any questions for Brenda, comments? If not, we'll go to February financials. Rebecca?
We had 2 payrolls. The numbers are there. They are going down. I saw the number for the payroll that's going out this week, and it's smaller than both of those. So we are seeing that progress of like revamping things, not filling certain positions, you know, things starting to go away. So, it is getting smaller, the number for the payroll. The claims, those are up this month. We did use some of that money that came in for that state fiscal year 23 dish. We paid off some things with the state, different things like that. So those claims are up. That patient refund number is mostly to our SNF group, our skilled nursing facilities that we have IGT relationships with. We're still seeing where their payments are coming to us for certain things. So once a week, we look at that and get that money to them so that they're not losing out on their cash flows. But in order for us to do that, it has to kind of roll through that patient refund process. The accounts recommended for charge off, the totals are there. Those would match the totals that you saw in the write-off, the review write-offs. And for the month, we were at a net income, and for the year to date, we are at a net income as well.
Any questions for Rebecca? If not, I'll ask a motion to approve the financials. Jimmy makes the motion, Harry seconds, all those in favor, aye?
Aye.
Any nays? Financials approved, thank you, Rebecca. Now, credentialing report, Dr. Pete, Dr. Mike, anything?
I wasn't at that meeting.
These were all reviewed and recommended for approval. Most of them are reappointments. And then, one new emergency physician appointment.
Okay. Any questions for Doctor? If not, I'd look for a approval of the credentialing.
So moved.
Dr. Pete, Harry second. All those in favor?
Aye.
And nays? Okay. Let's go to Buildings and Ground Committee report. Rick, if
I don't have
something's
anything.
on there.
Nope, I'm good.
Got anything, Brenda?
No.
Anybody have?
Replacement, how are we doing there?
Yeah, our Kyle's replacement, started on Monday, Jason Whitcomb started on Monday.
Mentioned the name earlier.
Yeah, so he's now onboarded and you'll meet him soon. Well, he's onboarding, I should say,
Yeah.
started Monday.
Will he possibly be at the next monthly meeting?
That's up to you all, you know, historically, we'd have Kyle attending meetings, that's up to you all if you want Jason to attend meetings as well.
Something we can discuss on executive meeting, I guess.
Okay,
I'd be nice for everyone to meet him.
okay. Let's make sure he comes to the next meeting anyway, then we'll, okay,
We can do that.
thank you. Finance and Planning Committee, Rebecca?
You had a meeting, I was not there, so Brenda, did you wanna?
Our Finance and Planning Committee, met with our compliance team and discussed, some ongoing investigations.
Governance Nominating Committee, Jimmy?
We had two people, up for renewal for the board of directors, a gentleman named Mike Crane and Tim Warren. And, as far as I can tell, everybody agreed it was a good idea and keep them on.
That's their biggest mistake.
I'm not gonna tell you how much they pay.
If I leave, I'll get to get some county help, for groceries.
I will take it as a toss-up.
Okay. Okay, thank you, Jimmy. Green County General Hospital Foundation report, anything, Brenda?
Yep, so, the last couple of years during Hospital Appreciation Week, we have, also had a foundation fundraiser that is to, support your GCGH hero and buy flowers. So, we're having that again this year. All of the flowers are actually donated by Gina's Watering Can, but people can pay, $5 and buy a carnation, and send a little thank you note to the staff member that they wanna recognize. So those flowers are available, there's a QR code. You can just fill it out and order flowers for any staff person that you want. They'll be delivered by our foundation on, during Hospital Appreciation Week.
Oh, medical staff report. Doctors, have anything?
We had a routine meeting, that was fairly uneventful. One thing that is required of the lab is that we approve the outside lab, reference labs and critical values and lab panels. So all that was taken care of in preparation for the Joint Commission survey for our lab, which is expected in the next couple months.
Okay. Is the lab ready for their joint commission?
Yes, we are.
Yeah. Okay. Anybody from the public here? Nobody online, or anything? Any new hospital business? Or old hospital business, either one? If not, I would ask for motion of affirmation, the executive board trustees met, regular meeting in which there were no items discussed, other than those on the agenda, no action taken.
So moved.
Tim and Harry,
Second.
thank you. Meeting adjourned.